Good afternoon and welcome to RCI's Navshikhar channel. I welcome our viewers to our show today. The topic of discussion for today is early intervention in autism spectrum disorder. And to discuss with us, we have on our panel Viveka Chattopadhyay. She is a resource person for Autism for Action, and Indu Jaiswal, who is the Director of Education for Action for Autism. Thank you, ma'am, for joining us. Now, before we start on this topic, I would like to give a brief introduction as to what autism basically is. It is a brain development disorder which is generally seen in children between the ages of 0 and 3. Now, what is autism spectrum disorder? It is a group of disorders which generally has signs that can be mild or severe depending. Now, as we say, prevention is better than cure, so the importance is very important for early intervention rather than later treatment. So today, this is what our discussion is all about, of the importance of early intervention. And before we start on the discussion today, I would like our viewers to please call us for any kind of queries relevant to this topic on our toll-free numbers or on our phone numbers that I'll just provide you with. Our toll-free number is 1800112008. The phone number is 265-11613 and the fax number is 265-11609. I would now like to start with the discussion. Ma'am, first starting with you, if I could just ask you, could you just give a brief introduction of what autism is actually?
Like you rightly said, when we talk about autism spectrum disorders, then it's a group of disorders, like you rightly mentioned, and we say it's a group of neurobehavioral disorders, because in all these disorders the symptoms are seen in the form of unusual behaviors, and essentially these behaviors or these difficulties are in three areas: in language and communication, in social interactions, and in what we say inflexibility in the way they think and they behave. So there are a number of disorders that come under the autism spectrum, and the most commonly used term is autism.
And what exactly is early intervention? What do you mean by early intervention of autism spectrum disorder?
Yeah, early intervention, whether it's autism or any other condition, is always very important, and that's what we're going to talk about today. So what is early intervention? The term early intervention refers to services given to very young children with special needs, generally from birth until the child turns 5. For this reason, these programs are sometimes called birth to 5 or 0 to 5. So early intervention का मतलब है कि जो प्रारंभिक या जो शीघ्र इंटरवेंशन दी जाती है बच्चे को, और हम सबको मालूम है कि when the child is born, the child will learn through interaction with the environment, and the first few years of life are very important because that's the time when the child is getting a lot of new experiences with his environment, and lot of improvement progress can take place during this phase. Essentially हम बोलते हैं कि birth to 5 years, that after the child is born until 5 years, a lot of progress can take place if we provide early intervention. Since autism is a disorder in which the behaviors sometimes become more obvious when the child is a little older, say around 2 years or something, parents do not note anything different in the child earlier. So even I would say that we must give autism a little more relaxation because of the very nature of the disorder. Sometimes the kids receive a very delayed or a late diagnosis, so we would like to extend early intervention to at least, I think, 6 to 7 years in case of autism. But essentially it means like 0 to 5 years, the work which is done with the child at that time.
So that means between the age of 0 to 6 years or 7 years probably is the correct time for the parents to analyze that there are signs that the child is showing of autism, and they can go to the doctors or the consultants.
Maybe earlier than that, after around 2 years, and work with the child. Just start working with the child. Put him on an intervention program, maybe after 2 years or even before that, by 18 months, and we'll come to that, how we do the screening of the children.
So what are the signs that the parents should observe before taking a child to a specialist?
We will be mentioning the screening tool also, but there are some very, typical signs that you see when a child is not playing with toys in a very meaningful manner after completing 1 year, or if the child is doesn't have joint attention, which means that he cannot, share his attention with others. So if the child sees something very exciting, he sees someone passing with balloons, or he sees an elephant, and he just, laughs and he smiles and he's clapping his hands, he's just happy, but he doesn't feel the need of calling another person and showing him, look, something interesting is happening. Or if the child never ever pretends, like to like typical हमारे कंट्री के, हमारे कल्चर के हिसाब से अगर हम बोले, तो अगर कोई बच्चा कभी भी अपने फादर की तरह अपने मोटरसाइकिल को, या अपनी जैसे फादर कार चलाते हैं वैसे साउंड्स नहीं निकालता, या अपने बाइसिकल को थोड़ा टेढ़ा नहीं करता जैसे स्कूटर्स को लोग करते हैं, या कभी कोई शॉपिंग बैग नहीं रख लेता अपने साइकिल के आगे कि मैं मार्केट जा रहा हूँ, और अगर बच्चा कभी किचन में जाके ही डजंट टेक द फ्लोर, और वो आटा लेके उसकी रोटी नहीं बेलता मदर की तरह, तो definitely these are some of the things, some of the signs which can indicate autism. There's lack of pretend play, and there's lack of joint attention. Very often children with autism, they will not point like this. वो इंडेक्स फिंगर के साथ पॉइंट करके अपने इंटरेस्ट की चीज़ दूसरे को नहीं दिखाएंगे, एंड that's a typical sign. Most of them, we would say more than 95%, they would not point when they are very little with the index finger, whereas other kids would do it. So there are a lot of symptoms because it's a spectrum, but when we are screening a child, these are the things that we look for in the initial stages.
So that means if there are any signs that the parents observe in their children, they should immediately go to specialist or a consultant so as to determine what the problem is really with the child, if he's suffering from autism or if it's not so. Okay. So ma'am, why do you feel early intervention is so important?
Yeah, early intervention is important to provide support to the families, to support their children's development, to promote children's development in key domains such as communication or mobility, to promote children's coping confidence, and to prevent the emergence of future problems. So इसका क्या मतलब है कि हम लोगों ने पहले ही बोला है कि ऑटिज्म जो है उसमें 3 एरियाज में डिफ़िकल्टी है, लैंग्वेज में है, कम्युनिकेशन में है, सोशल इंटरेक्शंस में है. तो क्या है कि अगर हम शुरू में ही बच्चे को सही तरीके का इंटरवेंशन दे देंगे, सो some of the difficulties with which the child would otherwise face later on, we'll be able to take care of them. Now autism is a lifelong condition. We're not saying कि early intervention provide करके we are going to cure it or the child is going to recover 100%. No, but a lot of the difficulties which would come up later, और जो बाद में जब बच्चा बड़ा हो जाता है और कुछ उसके बिहेवियर्स इतने सेट हो जाते हैं और उसके रिस्पॉन्सेज अपनी एनवायरनमेंट को के प्रति इतने सेट हो जाते हैं, वो अपनी एनवायरनमेंट को एक टिपिकल वे में समझने लगता है और उसी के आधार पर रिस्पॉन्सेज देता है. नाउ those things can be taken care of to a large extent if there is early intervention, so that we work in a way that when the child is little, he perceives the world जितना possible हो सकता है as the other people. So very important for the family also, because early intervention is all about training the family. So even like later on coping strategies family की भी better होती है early intervention से.
So that means early intervention is not important just for the child with autism, but also for the parents and the families of the child who's suffering from autism. Okay.
Yeah, and there are many more reasons, and that explain the need for early intervention. The rate of development of the preschool child, especially 2 to 6 years, is very rapid. Is so rapid that the child can be given more learning experiences. Children are by nature very flexible, and their growth and development can be modified extensively in a variety of directions. Parents can also benefit from an early intervention for the child because they can receive guidance. Now, like the first 5 years, 5 to 6 years of life, like we said this earlier also, are very important, क्योंकि जो ब्रेन है उसका काफ़ी मैच्योरेशन और होता है. और अगर हम चाइल्ड डेवलपमेंट पढ़ें तो द कॉग्निटिव डेवलपमेंट ऑफ द चाइल्ड, द सोशल डेवलपमेंट ऑफ द चाइल्ड, सारी ही जो बच्चे की डेवलपमेंट्स होती हैं वो डिपेंड करती हैं ऑन द काइंड ऑफ एक्सपीरियंसेस ही गेट्स when he interacts with his environment. So like during this period, through an early intervention program, and as we go through today's talk, you would see कि हम लोग early intervention में कोई बच्चे को academics पढ़ाने की बात नहीं कर रहे. We are exposing the child to the world more, so that through those experiences he learns to learn. Because how do children learn? It's a very natural process, but when a child has autism, he is not understanding 100% the instructions which are given to him. He's not understanding 100% why people behave in a certain manner, why they interact in a certain manner, or what is he supposed to do. So if we can provide the right appropriate experiences to the child, then the brain also will develop better. So it's all about giving, appropriate experiences. Then the other thing is like there are different models of early intervention which we'll talk about. Parents, siblings, they play a very important role, and they're in the field of disability. We are trying our best that a child the rehabilitation needs to happen within the community, within the home. So obviously the training of the whole family is very important, and if we can work on an early intervention program, then not just the training, even acceptance of the child with autism would be better right from the beginning.
So that means since the child's brain grows rapidly from the age of 2 to 6 years, it's very important to have an early intervention so as to give a proper learning experience to the child, and also the acceptance from the families is also very important with the process of early intervention.
Because family को भी support चाहिए, क्योंकि ये जो बच्चे हैं जिन्हें ऑटिज़म है, मोस्टली ये देखने में आम बच्चों की तरह ही दिखते हैं. इनके खाली बिहेवियर्स थोड़े अलग होते हैं. तो कम्युनिटी को, नेबर्स को, अगर ये किसी प्री स्कूल में जा रहे हैं वहाँ पे, एंड इवन फॉर देयर ओन फैमिली हु डजंट हैव एन एक्सपोजर टू ऑटिज़म, उनको भी एक्सेप्ट करना कि बच्चा अलग है थोड़ा मुश्किल होता है. तो अगर उनको एक्सटर्नली ये सपोर्ट मिलेगा, ये ट्रेनिंग मिलेगी, इट बिकम्स ईजियर फॉर देम. Again, because early intervention programs are very well planned, so early intervention promotes biological, physical, emotional, social and intellectual growth of the child, and for ecology in which the child lives. Especially when the child has some kind of a disability like autism, the early intervention is more effective than introducing compensatory or remedial intervention only at a later stage. तो ये जो प्रोग्राम्स है अर्ली इंटरवेंशन के, ये बहुत स्पेसिफिक होते हैं ऑटिज़म के लिए. दे आर प्लान्ड फॉर अ चाइल्ड विद ऑटिज़म. दे विल बी वेरी डिफरेंट फ्रॉम प्रोग्राम्स विच आर डन फॉर चिल्ड्रन विद अदर डिसेबिलिटीज़. सो व्हाट हैपन्स, एन ओवरऑल डेवलपमेंट ऑफ द चाइल्ड विल टेक प्लेस. एंड ये क्या है कि बच्चे की जो नेचुरल एनवायरनमेंट है, वो जिस एनवायरनमेंट में रहता है वो इन्वॉल्व हो रही है यहाँ. बिकॉज मैनी ऑफ द मॉडल्स ऑफ अर्ली इंटरवेंशन टॉक अबाउट प्रोवाइडिंग द इंटरवेंशन विद इन द होम. सो इट्स इन अ नेचुरल सेटिंग. अदरवाइज क्या है कि अगर हम एक किसी एक थेराप्यूटिक एनवायरनमेंट बना लें, किसी सेंटर में जाके बच्चा अगर सिर्फ वही सीख रहा है, सो वेरी ऑफन इट बिकम्स वेरी डिफिकल्ट फॉर द चाइल्ड विद ऑटिज्म to bring what is learned in a very so called artificial situation into the natural situation. So early intervention program, it emphasizes a lot कि जो बच्चे की एक जो उसकी जो स्वाभाविक एनवायरनमेंट है, जो उसका स्वाभाविक वातावरण है, जिसमें उसके माँ बाप हैं, उसके पड़ोसी हैं, जिस एरिया में वो रहता है, अगर अर्ली इंटरवेंशन में वो लोग सब इन्वॉल्व होंगे तो क्या है कि ऑटोमेटिकली क्या होगा, जो वो सीखेगा वो उसको उसका प्रयोग भी कर पाएगा. ही विल ऑल्सो बी एबल, बिकम्स वेरी फंक्शनल वट एवर ही इज लर्निंग, बिकॉज इट इज़ विद इन द नेचुरल environment. And again, like earlier said, कि अगर हम early intervention provide करेंगे तो later on जब बच्चा बड़ा होगा तो आसानी होगी. बिकॉज बाद में फिर इंटरवेंशन और रिमीडियल प्रोसेसेस को करना, जब बच्चा बड़ा हो गया है, थोड़ा रिजिड हो गया है, ऑटिज्म में ज़्यादा रिजिडिटी भी होती है, तो सिखाना मुश्किल होगा. इसीलिए शुरू से शीघ्र intervention is very important.
So that means the earlier we intervene, the better it is, because the child is more flexible when he's younger. When he'll grow older, he'll definitely become more rigid, and it'll be definitely more difficult to cope up with the child and to have some therapies for the autism of the child at a later stage in life. So it's very important that it's intervened as early as it's possible. So ma'am, what do you think is the earliest time that one can detect autism in a child?
The screening is done at the age of 18 months, and we'll talk about it in a while.
Okay, so how do you implement early intervention?
Yes, now how do we do it? कि it's like we're saying कि early intervention ज़रूरी है. Parents को कैसे हम provide करें? उन्हें तो बहुत बार मालूम भी नहीं होता कि बच्चे के साथ क्या प्रॉब्लम है, वो समझ नहीं पा रहे बच्चा क्यों डिफरेंट है और क्या उसमें डिफरेंट है, क्योंकि बहुत सी चीज़ों में वो आम बच्चों की तरह दिख रहा है, बहुत सी चीज़ों में वो अलग लग रहा है. सो इसको हमने कैसे इम्प्लीमेंट करना है? नाउ हाउ डज वन इम्प्लीमेंट इट? सर्विसेज इंक्लूड स्पेशल एजुकेशन, स्पीच थेरेपी, occupational therapy, physical therapy if required, provided either in a center or in the child's home. The hope is that these services provided early will address any delays in development so that the child will not need services later on. Now, services जो हम बोल रहे हैं कि बच्चे को अगर हम शुरू में ही घर में या किसी सेंटर में उसको ऑक्यूपेशनल थेरेपी, स्पीच थेरेपी, स्पेशल एजुकेशन दिलाएं तो चांसेस है कि आगे जाके इनकी ज़रूरत नहीं होगी. अब बिल्कुल ज़रूरत नहीं होगी ये कहना गलत होगा, बिकॉज ज़रूरत रहेगी, बट द मेन एम ऑफ एन अर्ली इंटरवेंशन प्रोग्राम इज़ कि हम बच्चे को कितना मेन स्ट्रीम कर सकते हैं, ज़्यादा से ज़्यादा मेन स्ट्रीम करने के लिए इसका एम है कि अगर हम इन चीज़ों पे शुरू से काम करेंगे, सो देयर इज़ अ चांस दैट दिस चाइल्ड माइट बी एबल टू गो टू अ स्कूल. इन अ वे इट्स अ स्कूल रेडीनेस प्रोग्राम ऑल्सो. सो इफ ही इज मेन स्ट्रीम विद अदर चिल्ड्रन, देन ऑल दीज नीड्स लाइक ऑक्यूपेशनल थेरेपी एंड ऑल वो चलेंगी, बट मेनली वो क्या है, उसका सारा एजुकेशन, सारे उसकी जो सोशल लर्निंग है, एवरीथिंग वो एक आम बच्चे की तरह वो चलती रहेगी. ये रोल क्या होगा इन सब प्रोफेशनल्स का, इसके बारे में भी हम बात करेंगे थोड़ी देर में. लाइक अभी आपने पूछा कि हाउ अर्ली डज वन नो दैट अ चाइल्ड हैज ऑटिज्म. सो दिस इज अबाउट स्क्रीनिंग ऑफ अ चाइल्ड विद ASD. द स्क्रीनिंग कैन बी डन एट 18 months and the at risk of ASD child can be detected. So this can be done at 18 months, and the child at risk of ASD can be started on an early intervention program as early as this age. The screening tool used is CHAT, checklist for autism in toddlers. Later, around 30 months, a diagnostic assessment is done for a confirmed diagnosis. तो 18 मंथ्स, 1.5 साल की उम्र में हम बच्चे की एक स्क्रीनिंग कर सकते हैं जो कि कंफर्म्ड डायग्नोसिस नहीं होता, लेकिन हम एक पता लगा सकते हैं कि बच्चा एट रिस्क है. तो उस वक्त अगर हम अर्ली इंटरवेंशन स्टार्ट कर दें तो हमें क्या है कि बच्चा बहुत प्रोग्रेस करेगा. ASD है, बहुत फ़ायदा होगा. और बाय चांस अगर बच्चे को ASD नहीं है और वो किसी और कारण से कुछ सिम्टम्स दिखा रहा है तो बाय 30 मंथ्स हमें मालूम चल जाएगा कि कंफर्म्ड है कि नहीं, बिकॉज ऑटिज़म लाइक इज़ फुली ब्लॉन, या इसके जो सिम्टम्स होते हैं वो बाय 30 मंथ्स ऑफ एज मैनिफेस्ट हो जाते हैं, दिखने लग जाते हैं. और जो हम टूल यूज़ करते हैं स्क्रीनिंग के लिए उसको हम चेकलिस्ट फॉर ऑटिज्म इन टॉडलर्स कहते हैं. और जैसे पहले बताया कि इस टूल में जो हम मुख्य रूप से देखते हैं दैट इज़ द जॉइंट अटेंशन, कि इफ़ आई टेल द चाइल्ड शो मी द बल्ब or show me the fan, so the child looks at the fan, that's not enough. The child looks at the fan and then looks at me. That is what is needed, क्योंकि joint attention वहाँ आएगी. और या वो पॉइंट करके फैन करके हमारी तरह देगा, ऐसे दिखा के और हमें देखेगा, दैट इज़ जॉइंट अटेंशन. फ़ैन बोलने से बस फ़ैन देख लेगा तो वो काफ़ी नहीं है. बच्चे को बहुत से खिलौने दिए जाते हैं, छोटे छोटे कप प्लेट्स हों, और देखा जाता है कि उनसे वो क्या करते हैं. इफ देयर इज अ डॉल एंड इफ देयर इज अ comb and a cup and a plate, what exactly would the child do? We have some things over here. So if I leave a child with all these things, an 18-month-old child, so there is a possibility कि जब बच्चा हो, अगर आम बच्चा जो है वो ये करेगा क्योंकि यही चीज़ें अवेलेबल हैं उसके पास, तो वो ये करेगा. अगर कोई कप होगा तो उसको वो चाय पिलाएगा. सो अगर बच्चे में ऑटिज्म है तो इस तरह का प्रिटेंड प्ले जो है वो नहीं दिखेगा. 18 मंथ्स की एज में वो ये नहीं करेंगे. हो सकता है कि वो उससे रेपिटेटिव वे में खेलता रहे, इसी को हिलाता रहे, ऐसे ही करता रहे, या इसके बालों को देखता रहे, या इसकी आँख में अपने फिंगर्स डालता रहे. अगर उसको कार दी जाएगी, और जैसे कार है, आप प्रिटेंड प्ले जो है वो 14 महीने तक 14 मंथ्स में भी डेवलप हो जाता है. सो अगर वो बच्चे के पास कार होगी, वो कुछ ना कुछ कार को चलाएगा, पी आवाज़ निकालेगा, कभी अपने हाथ के ऊपर ले जाएगा, कभी चेयर के नीचे ले जाएगा, तो वो प्रिटेंड करेगा. बट यदि ऑटिज्म है, बच्चा शायद रिपीटेटिवली कार को ऐसे ऐसे करता रहेगा, और बहुत बार ये देखा जाता है कि वो पार्ट्स ऑफ ऑब्जेक्ट्स के साथ खेलते हैं, कि वो कार से अगर खेल रहा है तो खाली उसके व्हील्स को चलाता रहेगा और घंटों उसको देखता रहेगा, या खाली ऐसे करता रहेगा कार को. तो वो सेंसरी प्ले में बहुत इन्वॉल्व होते हैं, कि जो उनको देखने में और जो उनको साउंड के लिए है तो इसको गिराते रहेंगे, लेकिन मीनिंगफुल प्ले बहुत कम लगेगा. तो हम लोग जब स्क्रीनिंग करते हैं तो इन चीज़ों को देखा जाता है, और जो अगर लगे कि बच्चे में ऑटिज्म है तो एट 18 मंथ्स हम उसको कंफर्म डायग्नोसिस नहीं देते. वी से एट रिस्क, and we put the child on an early intervention program.
So that means the earliest is 18 months when the screening of a child can be done for autism, and that is the time when it can be earliest tested, and that is the time when it's not confirmed but they just give a degree of risk that
Yes.
yeah, the child might have autism, and the signs as they showed you, they can play with dolls. A normal child would maybe comb the doll's hair, but a child with autism will maybe have repetitive behavior. So yeah, definitely if there are any signs of autism at the age of 30 months, the consultants and the specialists will confirm that yes, the child has autism, and then they will carry on with the therapies or the processes that they can improve autism. So by now we've discussed what early intervention is all about and what is the need of early intervention. We'll carry on with the discussion, but that will be after a short break. It's time for a break now. See you after the break.
The chief handicap of the blindness is not blindness, but the attitude of seeing people towards them. आइए जानने और समझने की कोशिश करते हैं कि बधिरांधता यानी डेफ ब्लाइंडनेस क्या है. बधिरांधता एक स्थिति है जिसमें दृष्टिहीनता एवं सुनने की शक्ति में कमी आती है तथा जिससे विचारों के आदान प्रदान और रोजमर्रा की आवश्यकताओं की पूर्ति में समस्या उत्पन्न होती है. बलराम एक 9 साल का बधिरांत बच्चा है. वो एक प्री मैच्योर बच्चा है जिसका शारीरिक विकास उसकी आयु के अनुरूप नहीं हुआ था. वो एक निम्न वर्गीय श्रेणी से संबंध रखता है तथा 5 साल से लगातार नेशनल एसोसिएशन फॉर ब्लाइंड दिल्ली के प्रशिक्षण कार्यक्रम से संलग्न है. इन 5 सालों के अंतर्गत उसे रोजमर्रा के कामों में, हलन चलन में, उसकी शैक्षणिक जरूरतों के अनुसार संप्रेषण द्वारा प्रशिक्षण दिया गया है जिससे वो इन सब क्रियाओं में स्वावलंबी बन सके. बलराम बिना किसी सहायता के चाकू से फलों को काट सकता है. उनके छिलकों को कूड़ेदान में डाल सकता है. अपने बर्तनों को खुद साफ कर सकता है. उन्हें सही जगह पर रख सकता है. सही बर्तनों का चयन करके खुद खाना खाता है। एवं पानी की बोतल निकालकर पानी भी पीता है। इन सभी क्रियाओं में वो टेक्चुअल साइन लैंग्वेज से निर्देशों को ग्रहण करता है और अपने भावों को व्यक्त करता है। टेलर फ्रेम और ब्रेलर द्वारा गणित, पठन लेखन में भी प्रशिक्षण प्राप्त कर रहा है। सभी बच्चों की तरह उसका भी एक मनपसंद खेल है। उसे सेल फोन को अपने कानों पर लगाकर उसका कंपन महसूस करना अच्छा लगता है। कहा जाता है, वॉकिंग विद अ फ्रेंड इन डार्क इज बेटर देन वॉकिंग अलोन इन लाइट। कहने का तात्पर्य है कि वो लॉन्ग केन ट्रेवल, टैक्टाइल पाथ, ट्रेलिंग और लैंडमार्क्स द्वारा हलन चलन में भी सक्षम है और व्यायाम संबंधी क्रियाएं जैसे ट्रेडमिल, स्टैटिक साइकिल का स्वचालन भी कर सकता है। कहा गया है, द बेस्ट एंड मोस्ट ब्यूटीफुल थिंग्स इन द वर्ल्ड कैन नॉट बी सीन और इवन टच्ड, दे मस्ट बी फेल्ट विद द हार्ट।
Welcome back after the break. We were discussing today the importance of early intervention in autism spectrum disorder. Until now, we've discussed the early signs of autism, the age at which autism can be intervened, what exactly early intervention means, and why we need it. And now, to carry on the discussion, we will discuss the different models of early intervention.
Yeah. The different models of the early intervention. The first one is home-based. Potage is an example of home-based early intervention program. It promotes parents as primary teachers. Potage emphasizes the parent's role as the child's primary teacher. So, ये जो potage है, it's a very well-known model of early intervention. एंड इसमें क्या है कि बच्चे को घर में ही सिखाया जाता है और घर में ही स्पेशल कोई सोशल वर्कर होगा या whoever is teaching the family, वो घर में ही आएंगे and in the child's natural environment the parents are trained, the family is trained to train the child. So a program is made and then this person will keep on, the professional can be a special educator in autism or the social worker or the psychologist. They will keep coming after every, say, a predetermined period, like it could be after every 2 weeks or once in a month, and they give a program to the mother and also provide hands-on training to the mother as to how to work with the child. So that's a home-based model, and like I've earlier said, this model is very good because the child is learning within his home, which is his natural environment, and also the whole family is a part of the program. So like in our country, हमारी कंट्री में क्या है कि स्कूल्स भी जो हैं अभी इतना इंफ्रास्ट्रक्चर नहीं है, इतने रिसोर्सेज नहीं है, तो कोई भी स्कूल ऐसा नहीं है कि जो बहुत लंबे आज तक चलेगा. सो द चाइल्ड स्पेंड्स मोस्ट ऑफ द टाइम एट होम एंड दिस इज़ वंडरफुल बिकॉज राइट फ्रॉम द बिगनिंग व्हेन द चाइल्ड इज़ लिटिल द फैमिली इज़ गेटिंग ट्रेन्ड on how to handle the child, and they are becoming so independent that they are not going to depend on only professionals and schools, और वो ट्रेन होके अपने स्ट्रैटेजीज, अपने तरीके खुद भी बनाना सीखेंगे बच्चे को हैंडल करने के लिए.
So that means the first model that we discussed for early intervention is the home-based model, wherein the parents act as the primary teachers and the whole family can be very supportive. The child learns at home, the whole experience is very family oriented, so it's very important for the child.
Yes, the next is the precision teaching method of potage. The precision teaching is an established approach that is based on behavioral principles and has been particularly successful with children with disabilities, especially autism. This method utilizes a set of simple but effective procedures that teachers or home visitors and parents follow to identify, monitor and make decisions about critical skills or behaviors a child needs. तो ये प्रोग्राम भी जो है ये पोटाज का ही है, और पोटाज में और इसमें क्या है कि थोड़ा सा डिफरेंस ये है कि जब एक पोटाज प्रोग्राम फॉलो होता है तो उसमें कई बार क्या है, जो विजिटर आता है, प्रोफेशनल आता है घर में, वो मदर के साथ एक डिस्कशन करते हैं और बताते हैं कि आप बच्चे को इस तरीके से सिखा सकते हैं, घर में क्या प्रॉब्लम्स आ रही हैं, काउंसलिंग करते हैं. लेकिन जो प्रिसिशन मेथड है ये बहुत ही स्पेशलाइज्ड मेथड है, बिकॉज यहाँ पे पूरी तरीके से बिहेवियरली बच्चे के स्किल्स को लिया जाता है कि बच्चा खा नहीं रहा अपने आप, उसको इंडिपेंडेंटली खाना सिखाना है. तो हाउ विल द चाइल्ड होल्ड द स्पून, या वो अपने हाथ में खाना कैसे लेगा, वो रोटी को कैसे तोड़ेगा, कैसे डिप करेगा, और वो पूरा जो प्रोसीजर है बच्चे को ट्रेन करने का, तो इन बिहेवियरल टर्म्स कि रोटी तोड़ना, रोटी को डुबोना और खाना, और इन अदर लाइक से another example in bathing, so the child going to the bathroom, undressing himself, picking up soap and pouring water with a mug. So in behavioral terms the skills are taken very very specifically. So this is a more detailed method of the potage where skills in the form of behaviors are taught to the child, and rather they are taught to the family, and then the mother or any other family member, they work with the child on these skills. So it's also a form of potage. It is also home based but more specific in terms of behavioral learning.
So the next model is precision teaching model, in which it's more detailed, more specific. The skills and the behaviors are observed in more details and it's more intricate. So yeah, that's a better
And
model.
we come to the third model, which is a center based intervention. The family or whosoever is the primary caregiver in certain cases takes the child to the center where the child is assessed, and a team of professional, paraprofessionals and non-professionals work together for the early intervention. तो इसमें हम ये टीम की जो बात कर रहे हैं, इसमें हम बोल रहे हैं कि प्रोफेशनल्स हैं, पैराप्रोफेशनल्स हैं, तो और नॉन प्रोफेशनल्स भी हैं. तो ये जब कहीं पे होता है, फॉर एग्जांपल एक हम बात करते हैं कि कोई स्लम एरिया है या कोई ऐसा एरिया है जहाँ पे पेरेंट्स बहुत ज़्यादा एजुकेटेड नहीं है, दे डोंट हैव मच एक्सपोजर एज टू वेयर टू गो. सो ओवर देयर वी नो कि आंगनवाड़ी वर्कर्स होते हैं, सोशल वर्कर्स होते हैं, तो वो क्या है कि दे आर लाइक नॉन प्रोफेशनल, दे आर नॉट ट्रेन्ड प्रोफेशनल्स बट दे ऑल्सो टेक पार्ट. शायद मदर के मुकाबले कुछ केसेस में ये जो आंगनवाड़ी वर्कर साथ में आती हैं वो ज़्यादा चीज़ को ग्रास्प करेंगी और फिर वो मदर को भी सिखा सकती हैं. बहुत से सेंटर्स में इंडिया में इस तरीके का अर्ली इंटरवेंशन प्रोग्राम होता है, और हमारे साथ विवेका मैम है. विवेका चट्टोपाध्याय ने एक ऐसे प्रोग्राम को कोऑर्डिनेट किया है एक्शन फॉर ऑटिज्म में, जिसको हम मदर चाइल्ड प्रोग्राम कहते हैं. एंड आई थिंक विवेका यू कैन टेल अस मोर अबाउट द प्रोग्राम. इट्स अ सेंटर बेस्ड प्रोग्राम.
Okay, in the mother child program, we train a group of mothers, maybe 10 to 15 mothers. We train them and we train them in all aspects of this. We train them in joint attention, in communication, in activities of daily living. So that it's a 3-month program. So after that, the mothers can go back to wherever they come from and not depend so much on professionals. They can train, they can teach their own children. So we have group activities, we have one-on-one, we have eating together, so that the parents are trained in all aspects of autism.
So that means the center-based program is basically for training the mothers,
Yeah.
so that they can go back home.
Further train their children. The children also come with them, of course.
Okay.
और इस तरह का जो सेंटर बेस्ड प्रोग्राम होता है उसमें एक एडवांटेज क्या है कि एक या दो प्रोफेशनल्स हैं
हाँ.
और वो लोग मिलके इतने सारे मदर्स को ट्रेन कर रहे हैं एंड समटाइम्स व्हाट हैपेंस द टीचिंग लर्निंग मटेरियल्स वो एक सेंटर में अवेलेबल होते हैं तो जो प्रोसेस है वो फास्टर होता है एंड इट इज़ वेरी गुड. एक मॉरल बूस्ट मिलता है, एक इमोशनल सपोर्ट भी मिलती है क्योंकि जब वो 15 मदर्स एक साथ ट्रेन होती हैं और एक दूसरे को देखती हैं दे नो दैट आई एम नॉट अलोन and my family is not the only one which is affected. So I think बहुत holistic सा एक approach हो जाता है कि जब वो एक साथ होते हैं. So दोनों ही models जो हैं home based जो center based उनके अपने अपने advantages हैं. और अभी हम थोड़ी सी बात करेंगे इन लाइक वी विल नॉट गो इनटू मच डिटेल्स बिकॉज थ्रू दिस डिस्कशन हम एज इट इज़ इंटरवेंशन की बात करेंगे तो ये सारे जो प्रोफेशनल्स हैं और दूसरे लोग हैं इस प्रोग्राम में जो इन्वॉल्व होते हैं वी विल बी टॉकिंग अबाउट देयर रोल. सो वी आर गोइंग टू टॉक अबाउट द रोल ऑफ द की प्लेयर्स एंड in many places there's a service coordinator which means the person who actually coordinates the whole program and he's a kind of a linkage between everyone who's involved in the program, the families, the educator. Then we also have an early interventionist special educator जो इस प्रोग्राम को पूरा प्लान आउट करता है और फैमिली को गाइड करता है कि कैसे करना है. अगेन मॉडल्स कैन बी वेरी फ्लेक्सिबल लाइक विवेका वाज लाइक द सर्विस कोऑर्डिनेटर एंड द स्पेशल एजुकेटर बोथ together for the program that she was coordinating. Then in some places they have speech language pathologist. एक speech therapist भी कई जगहों में होते हैं और यहाँ पे हम ये mention करना बहुत ज़रूरी समझते हैं कि autism is not only to do with speech. ऐसा नहीं है कि ऑटिज्म में कि सिर्फ एक स्पीच ही एक इशू है, वहाँ पे कम्युनिकेशन इशू है. बहुत से बच्चे हैं दे हैव लॉट ऑफ स्पीच बट दे डोंट यूज इट मीनिंगफुली. सो वी नीड मोर ऑफ कम्युनिकेशन थेरेपी एंड वेरी ऑफन स्पेशल एजुकेटर्स कैन ऑल्सो मैनेज इफ देर इज अ स्पीच एंड लैंग्वेज थेरेपिस्ट हु अंडरस्टैंड्स ऑटिज्म एंड ही नोज हाउ टू यूज सर्टन सिस्टम्स like say picture exchange communication system, sign language. It will be very very useful. Generally a speech and language pathologist helps a child to use language. Children with autism benefit from intervention by a speech and language therapist who can provide training in alternative and augmentative communication like sign language, picture exchange system, etc. So the other problems like garbled speech, inadequate speech, slurred speech, stammering, this also can be addressed by the speech therapist. Then we have occupational therapist, very important person in the intervention, in the early intervention of the child. This person specializes in fine motor like small muscle movement skills, oral motor skills like खाने में, बोलने में जो activities होती हैं and activities of daily living. An occupational therapist might help a child learn to use a spoon or get dressed. Therefore, the role of an occupational therapist is very important as he or she addresses the needs for training in activities of daily living involving body use. Issues related to difficulties in writing, coloring, copying from blackboard and hyperactivity can, I would rather say, also be taken care of by an occupational therapist. Since children with ASD have difficulties in processing and integrating sensory information, they have difficulties in performing these activities like ADLs, copying from the board, holding pencil, paying attention to relevant stimuli, and OT having this knowledge can provide sensory integration program. तो हम लोगों ने speech therapist की बात की है और हम लोगों ने occupational therapist की बात की है और यहाँ पे ये कहना बहुत ज़रूरी है कि both the speech therapist and the OT they need to understand autism और autism में क्या need है, किन चीज़ों पे काम करने की, तब उनकी intervention बहुत useful होती है.
So that means there are various professionals involved in this whole procedure of autism, early intervention, like speech therapists, occupational therapists, then there are special educators who are all very important in their individual roles they play over here.
Yes, and the last slide has some other professionals and non-professionals, very important people, doctor. Occasionally, a medical staff person participates on the team for early intervention. Particularly when the child has serious health problems, he or she provides valuable information about the needs of the child. Community workers like Anganwadi staff, Balwadis, and other professionals such as preschool teachers, educators. These are people who are the most commonly accessible and parents reach first to. Therefore, it is very important that awareness and sensitization is available so that they can identify cases and direct them to the desired services. जब किसी भी बच्चे में पेरेंट्स देखते हैं कि एक सामान्य बच्चे के लाइक कंपैरिजन में देयर इज सम डिफरेंस, द फर्स्ट पर्सन दे गो टू इज द डॉक्टर. So very important for doctors to be able to identify autism as early as possible. And not just that, the role of the doctor is very important because it's only like, you know, the parents will initially depend on the doctor. कि अगर doctor, does the doctor know that okay, he's done a screening, he says the child is at risk for autism, but does the doctor know that from there where does he send the family? अगर ये information डॉक्टर के पास नहीं है तो family gets stuck. So for doctors to know what next, what is the therapy, the educational program, the training that a child needs, that's very important. Similarly, a mother might approach an Anganwadi worker or a Balwadi worker or a teacher in a school, in a play school, a preschool, might notice that the child is different. तो ये सारे लोग जो है इनका बहुत important role है early intervention में, because ये लोग पेरेंट्स को अवेयर करेंगे और इनको अगर हम इस लेवल पे अगर हम अपनी कम्युनिटी में अर्ली इंटरवेंशन के बारे में, ऑटिज़म के बारे में सेंसिटाइजेशन और अवेयरनेस क्रिएट करें तो ये लोग अर्ली इंटरवेंशन प्रोग्राम्स की और फैमिलीज़ को डायरेक्ट कर पाएंगे.
So that means since the first person that a person will go to will be a doctor to determine if the child is suffering from autism or not, it's very important for the child and the parent to know that yes, the child has autism, and it's very important that the doctor provides proper guidance so as to tell them that even if the child has autism, what next after that, what next after the diagnosis has to be correct, and also provide future assistance and future guidance so as to tell them what they have to do in future with this diagnosis of autism now.
Absolutely. तो अभी तक हम लोगों ने बात की है कि अर्ली इंटरवेंशन की नीड क्या है ASD में, और दूसरी चीज़ की अर्ली इंटरवेंशन हाउ इट इज़ डन एंड व्हाट इज़ द टीम लाइक जो अर्ली इंटरवेंशन प्रोग्राम रन करेगी. सो नाउ लेट्स मूव इनटू द एक्चुअल इंटरवेंशन. एंड हम सबसे पहले बात करेंगे सेंसरी इंटीग्रेशन के बारे में. When we are providing early intervention, what are the different components and what are the different areas in which we provide intervention? Sensory integration. Sensory integration refers to the integration and interpretation of sensory stimulation from the environment by the brain, and the focus is on three senses: tactile, vestibular, proprioceptive. I'll go on to the next slide before I go into what it actually means. Sensory integration involves working on balance and movement, eye-hand coordination activities, fine and gross motor activities, providing child-specific input like deep pressures, textures, texture massage, etc. तो ये sensory integration क्या है और ये हम ऑटिस्टिक बच्चों को क्यों प्रोवाइड करते हैं, ये पहले जानना बहुत ज़रूरी है. कि जिन बच्चों को ऑटिज़म है उनके जो एक्सटर्नल एनवायरनमेंट है बॉडी का, सो ऑल द इंफॉर्मेशन कमिंग, सो व्हाट दे आर सीइंग, व्हाट दे आर हियरिंग, व्हाट द टच दैट दे आर फीलिंग, सो ऑल दी सेंसेस जो मैसेजेस इनको अपने एनवायरनमेंट से, इन सेंसेस से आती है, वो हमारी तरह इसको रिसीव नहीं करते हैं, एक अलग तरीके से इसको रिसीव करते हैं. फॉर एग्जांपल कि वो कुछ ऐसी आवाज़ सुन पाएंगे जो शायद हम लोग नहीं सुन पाए, वो लो फ्रीक्वेंसी साउंड पिकअप करते हैं. तो किसी सिचुएशन में अब मदर को इंस्ट्रक्शन दे रही है तो बच्चा उस आवाज़ के प्रति ज़्यादा संवेदनशील नहीं है, परंतु कोई बहुत दूर से उसको आवाज़ आ रही है जो कोई खास मायना नहीं रखती. इट्स नॉट इम्पॉर्टेंट, बट द चाइल्ड इज अटेंडिंग टू दैट साउंड. So that's the way their senses move, that work, that they might pay attention to some stimulation, to some कुछ ऐसी संवेदनाओं को वो रिसीव करते हैं और उनको अटेंशन देते हैं, उनके प्रति ध्यान देते हैं, जो बहुत ज़्यादा एक्चुअली मायना नहीं रखती है, एंड दैट अफेक्ट्स द लर्निंग. सो अ सेंसरी इंटीग्रेशन प्रोग्राम, लाइक वी सेड अर्लियर, कि एक ऑक्यूपेशनल थेरेपिस्ट असेसमेंट करके ये प्रोग्राम देता है, और इसमें जो है वो बच्चे की जो है बॉडी का बैलेंस है और जो मूवमेंट है उसके साथ कनेक्टेड, आई हैंड कोऑर्डिनेशन के साथ कनेक्टेड, बॉडी यूज़ के साथ कनेक्टेड जो एक्टिविटीज़ हैं उन पे वर्क करते हैं. कुछ बच्चों की ज़रूरत होती है दैट उनको बहुत प्रेशर की ज़रूरत होती है. इट्स लाइक समथिंग यू नो, लाइक अब बच्चे होंगे, आप उनको हल्का सा टच करो, अपना हाथ हटा लेंगे, लेकिन दे नीड डीप प्रेशर्स. व्हेन वी से डीप, इट मीन्स रियल डीप, कि बहुत उनको जोर के प्रेशर की ज़रूरत होती है. अगर आप उनके हाथों को इस तरीके से अपने हाथ में लें और उनको खूब अच्छे से प्रेस करें, उनको बहुत रिलीफ मिलता है. और ऐसा करने के बाद उनकी राइटिंग या फिंगर्स से वो कोई एक्टिविटीज़ करते हैं तो बेटर करते हैं. तो बहुत से ऐसे एक्सरसाइजेस हैं और एक्टिविटीज़ हैं जो पेरेंट्स अर्ली इंटरवेंशन प्रोग्राम में ट्रेन हो सकते हैं और अपने घर में ये इनपुट खुद भी प्रोवाइड कर सके ऑक्यूपेशनल थेरेपिस्ट से ट्रेनिंग लेके. और यहाँ कुछ स्लाइड्स हैं जो एक सेंटर बेस्ड प्रोग्राम की हैं, एंड वी कैन सी इन द फर्स्ट स्लाइड दैट देयर इज अ बॉय, अ चाइल्ड लर्निंग टू जंप ऑन अ टायर ट्यूब and walk around on it. This is known as a jumping island. अब इतने महंगी इक्विपमेंट तो फैमिली नहीं लेगी, सेंटर में हो सकती है, बट घर में क्या है कि कोई टायर ट्यूब हो, कोई पुराना गद्दा हो, मैट्रेस हो, बच्चे का आगे से हाथ पकड़ के उसको उस पर जंप करना सिखाएंगे. बहुत से बच्चे हैं जिन्हें ऑटिज्म है, दे हैव अ नीड टू मूव द बॉडी इन वन मैनर रेपिटेटिवली. वो जंप करेंगे, आगे पीछे होंगे, तो ये इनको इनपुट इन एक्टिविटीज़ के थ्रू दिया जाता है. ये एक है बॉल पूल. बॉल पूल क्या है कि ये एक बॉक्स की तरह होता है, और ये जो इसके अंदर बॉल पड़े हुए हैं ये एक तरह से टेक्सचर बच्चे को दे रहे हैं, और ये अपने आप को इसके अंदर बैठ के बहुत सिक्योर, बहुत अच्छा फील करता है. घर में पेरेंट्स को सिखाया जाता है कि बॉल पूल नहीं है, लेकिन बच्चे के लिए कोई कोना बना लीजिए आप, और आप एक कबर्ड रख लीजिए, और दीवार और कबर्ड के बीच में कुछ लाइक पुट अ मैट्रेस and put some toys, so the child feels very squeezy and very secure in that area. They love this kind of pressure and this kind of closed area sometimes. Here is a child sitting, और ये काफ़ी हाइपर एक्टिव चाइल्ड था, और जब ये इस एनक्लोज्ड प्लेस में होता था, इसको ये इनपुट मिलता था आसपास, तो इसको बहुत अच्छा लगता था इसके अंदर. देन दिस इज समथिंग अगेन लाइक एक बच्चे को सिखाया जा रहा है व्हील बैरो वॉकिंग, इसको बोलते हैं. तो प्रोवाइड्स इनपुट एट द जॉइंट्स, वेट बेयरिंग एरियाज, तो ऑल्सो गिव्स अ गुड बॉडी सेंस एंड कंट्रोल. नाउ यू कैन सी द चाइल्ड जिसको चलाया जा रहा है इस तरह से, उसकी बॉडी का पूरा वेट उसके हैंड्स और उसकी जो हैंड्स का जो जॉइंट है उसके ऊपर वेट बेयरिंग हो रही है, और ये बच्चे को बहुत रिलैक्स करती है. और इवन क्या है कि बच्चे को अपने हाथों की सेंस, अपने बॉडी की सेंस इससे बहुत अच्छी आती है, और बच्चे बहुत उसकी हाइपर एक्टिविटी के लिए, आई हैंड कोऑर्डिनेशन के लिए, और इवन होल्डिंग थिंग्स, ग्रिपिंग थिंग्स, कितनी ज़ोर से मुझे पेन को पकड़ना है, किसी चीज़ को कितना खींचना है, या कितना ज़्यादा खींचना है, या कितना कम खींचना है, ये सारे जो इनपुट है, इट हेल्प्स इन ऑल दोज थिंग्स. Then this is again like a rope ladder. Some of them are jumping, and climbing may help them because climbing is a linear thing. So like बहुत सी चीज़ें होती हैं. आप we can see in this slide only there is a rope ladder. Then no, my hand will go. It won't go there ना. So there is a rope ladder. There is a gym ball. एक येलो बॉल पड़ा है, इसको हम जिम बॉल कहते हैं. और आई हैंड कोऑर्डिनेशन के लिए टेबल के ऊपर काफ़ी पेग्स पड़े हुए हैं. और इस रूम में और बहुत सी चीज़ें होती हैं बॉडी बैलेंस के लिए, लाइक बैलेंस बोर्ड्स, ड्रेस बोर्ड्स होते हैं जिससे बच्चा बटन लगाना सीखता है, जिप बंद करना सीखता है. तो ये सारे एक SIT रूम में ये इक्विपमेंट होती है, और इसमें से बहुत सी इक्विपमेंट्स ऐसे लगता है कि घर में कैसे एक अर्ली इंटरवेंशन प्रोग्राम में घर में कैसे प्रोवाइड करेंगे, तो उसको प्रोवाइड करने के बहुत सारे सिंपल तरीके होते हैं. रोप लैडर नहीं है तो एक नॉर्मल लैडर पे बच्चे को चढ़ाया जाए या स्टूल लगा के उसको थोड़ा ऊंचा चढ़ने की प्रैक्टिस दी जाए. देन ये जो आई हैंड कोऑर्डिनेशन की एक्टिविटीज़ हैं, इसमें सिंपल बीड्स हैं, मोती हैं, उनको स्ट्रिंग में से डालना है और किसी बॉक्स में होल्स करके उसमें स्पून्स फिट करना, स्पून्स निकालना. तो we train the parents to prepare cost effective teaching aids, but in like a center based setup there are more resources, but हम इनको एक cost effective, एक easily like available तरीके से भी family को guide कर सकते हैं कि वो इन चीज़ों को घर में कैसे बना सकते हैं.
So that means the sensory integration is basically when the various sense organs like eyes, hands, nose and everything, sounds, when everything's integrated, coordinated, the movements are all integrated, the activities are coordinated. So that's all about sensory integration. Then we have various forms, as ma'am showed us in the clippings. There was a sit room, then there was a trampoline, there were various other measures which parents can use in the home as well as they can go to the center. They're cost effective, they can be a little expensive also, by which an autistic child can be allowed to play, do what he wants and therefore improve with the learning experiences. So just now we've discussed a lot about the sensory integrations, and before we continue further, it's time for a short break. So we'll see you after a short break.
हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. ओ मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
The state of knowledge exists. The will, the capacity, and method are usually the problem. मानसिक मंदता एक ऐसी विकलांगता है जो 18 वर्ष की आयु से पूर्व कभी भी हो सकती है, जिसमें व्यवहार अनुकूलता में कमी एवं बुद्धि क्षमता 70% से कम होती है. Alone we can do so little. Together we can do so much. भारतीय पुनर्वास परिषद द्वारा देश भर में पंजीकृत केंद्र इस बात को प्रमाणित करते हैं. NIMH प्रादेशिक केंद्र नई दिल्ली एक ऐसा ही केंद्र है जहां छात्रों को प्रशिक्षण दिया जाता है. जिसके उपरांत वे मंदबुद्धि बच्चों की सेवा में नियुक्त होते हैं. क्लासरूम टीचिंग, ग्रुप टीचिंग एवं भारतीय पुनर्वास परिषद के नव शिखर चैनल पर प्रसारित टेलीकॉन्फ्रेंसेस द्वारा संबंधित विषयों पर विस्तार पूर्वक ज्ञान दिया जाता है। मेडिकल, ऑक्यूपेशनल थेरेपी, फिजियोथेरेपी, स्पीच थेरेपी, साइकोलॉजी और स्पेशल एजुकेशन जैसे क्षेत्रों में छात्रों को प्रशिक्षित किया जाता है। प्रयोगात्मक अनुभव एवं अभ्यास के लिए टीचर ट्रेनिंग प्रोग्राम के उपरांत छात्रों को मंदबुद्धि बच्चों के साथ कक्षाओं में नियुक्त किया जाता है और इंडिविजुअलाइज्ड एजुकेशन प्लान का भी आधार बनाया जाता है, जिससे वे संपूर्ण शिक्षा एवं चिकित्सा शैली को समझ सकें। इस पूरे प्रशिक्षण कार्यक्रम के दौरान विद्यार्थी जर्नल्स, न्यूज़लेटर्स, पेरियोडिकल्स, चार्ट्स, मॉडल्स, कंप्यूटर ट्रेनिंग एवं टेक्स्ट बुक्स का उपयोग कर सकते हैं। कहते हैं, कीप योर फेस टू द सनशाइन एंड यू कैन नॉट सी द शैडो। इसी बात को ध्यान में रखते हुए विद्यार्थियों को सरकारी एवं गैर सरकारी संस्थाओं में नियुक्त किया जाता है, जहां वे मंदबुद्धि बच्चों के लिए निरीक्षण, प्रशिक्षण एवं अनुसंधान का दायित्व संभालते हैं और इसके पश्चात ये विद्यार्थी इस प्रशिक्षण का उपयोग मंदबुद्धि बच्चों के सामाजिक एवं शैक्षणिक उत्थान एवं विकास में करते हैं और एक लक्ष्य की ओर आगे बढ़ते हैं। और फिर लक्ष्य कितना ही दूर हो, फासला नजरों का धोखा भी तो हो सकता है। वो मिले या ना मिले, हाथ बढ़ाकर देखो।
Welcome back after the break. Our topic of discussion today is importance of early intervention in autism spectrum disorder. And before the break, we were discussing with ma'am the various issues relating to sensory integration, the movement, the activities, the coordination and integration required between the various sense organs of an autistic child, and how the parents are supposed to react to it, and how with the sit room, with the trampoline, with various other effective measures which are cost effective or a little expensive maybe, how an autistic child can be improved and treated. Now ma'am, coming to you, could you just tell us and elaborate on what early intervention exactly means and how is it so important?
Well, Indu has talked about early intervention, and the reason why we do early intervention for children with autism is because it is an extremely important. Indu has said that the brain develops during the age of between 0 to 5, and it is very important that we capture those moments, because children with autism generally find it difficult to learn from their surroundings like regular children do. That is why we need to provide them with experiences and with some kind of with teaching, so that they can learn things which other children learn from their environment. Before we start any early intervention program, what's the most important thing? We need to bond with the child. Our children need to learn, and we need to use reinforcers for that. Bonding with the child. Why do we need to bond with the child? Even regular children, आप जाके अंदर जाके एक बच्चे से बोलिए कि अच्छा ये करो या comb छुओ. The child will not do it. First, you have to build up a rapport. आपको दिखाना है कि to the child that you are fun. So first thing that you have to do is have fun with the child.
So that means the child has to first feel comfortable with you and only
Trust
then.
you, feel comfortable with you, and learn that you are fun. Our children with autism have a difficulty with other people. They'd rather play with objects than they don't find other people fun.
So that means they have a problem trusting the people.
It's not in trusting. They have difficulty in motivation. They have difficulty in social skills. When they have a difficulty in social skills, they find it difficult to relate to other people. So you have to tell them that no, I'm a fun person and it's fun working with me. So you have to bond with the child. Bonding with the child means that you don't take toys that you think are appropriate. If I think that a doll is appropriate for the child, I will not, and the child is busy playing with a car, I will not take the doll. I will take another car. And if the child is, so when the child is playing with the wheels of the car, I will also play with the wheels of the car. I will join the child in what the child is doing. Some way or the other, the child will look at me, saying, you know, what is this person doing? And maybe while I'm doing this, can make some noises like say, brrr, ooh, so that the child will look at me. Once the child looks at me, I've got it. Then I can start the work.
So that means it's very important to build a rapport with the child, gain the attention of the child, and then only can you carry on with the further process. Okay.
Use of reinforcers. Why do we use? I mean, the thing is that it's only when something good happens that we do a behavior. Supposing I have come for this teleconferencing, and somebody says, you know, it wasn't very good. So I feel a little thing, maybe I won't come again. But if someone tells me it's good, someone gives me praise, that my behavior will be repeated. And supposing you tell a child, oh, that's great, the child will want to do it again.
Yeah.
But what happens with our children is that social reinforcers don't work as well. They prefer things which they are interested in. So if the child is, take the car again, so if the child is interested in a car, and you give him the car to play with after you make him do an activity, he will probably repeat that behavior more than he would if you hadn't given him a reinforcer.
So that means the child displays repetitive behavior.
Not repetitive behavior. This is, supposing I am teaching a child something. I want him to do an imitation activity and I say do this. And the child does it, and I give him the car as soon as he does it. That is that I am reinforcing that behavior.
You should give a demo, you know?
Yeah, okay, let him do it. Yeah.
You want to be the child?
Yeah, I'll be the child. I'll be the child.
Okay. So it's like, you know, this is a child who's learning to do very simple imitation like clap hands. And or raise hand. It's a raise hand. And ये इसको हम इंस्ट्रक्शन पे बोल रहे हैं कि ऐसे करो, और बच्चे के लिए मुश्किल है तो जो टीचिंग प्रोसीजर है उससे हमने सिखा दिया कि पहले हमने उसको सपोर्ट करके सिखाया, अब ये इंडिपेंडेंटली कर रहा है और कुछ चीज़ें इसको ऑलरेडी आती हैं बहुत अच्छी तरह. ये इसकी नई चीज़ है डू दिस करना. क्लैप हैंड से पहले से बहुत अच्छी से करती है, अपना नोज़ दिखाती है. तो जब हम प्रोग्राम करेंगे तो इट्स लाइक बॉन्ड करेंगे इसके साथ. पहले अगर इसको पसंद है तो थोड़ा जैसे पूरा था प्रेशर देना, अगर वो भी एक तरह से रीइंफोर्समेंट होगी. And wow, good looking Viveka, that's a reinforcer. And then we can just tell her, come on, clap hands, touch nose, do this. Now this was the new item that I was teaching and she did it. Wow, she gets a reinforcer.
So this car I like very much.
Because she likes it. But I'm not going to give her, like if I feel the doll is good, वो हम नहीं देंगे. इसको कार ही पसंद है.
So अगर धागा पसंद है,
धागा देंगे.
Some children like combs. So you can give them a comb, whatever the child likes.
Okay.
It is very important that we do an assessment of what the child likes. It could be a kurkure, it could be chips, it could be toys, it could be string, it could be a comb, it could even be a pen. So it all depends on what the child likes. We have to see what the child likes, And once the child is doing a new activity, we reinforce him with that, and the possibility of that behavior occurring will be more.
So that means it's very important the assessment of the child is made. It's understood that what the child wants, what the child feels is good for him, what the child likes. Very important to understand what the child likes and to reinforce that behavior. Then we can make him do different activities also alongside with that. Okay.
When we are looking at early intervention, we must look at an autism-specific curriculum, content focusing on attention, compliance, imitation, language, and social skills. These are the areas in which our children have difficulty. So let's get on to it. We need highly supportive teaching and environments which deal with need of predictability and routine, and with challenging behaviors, obsessions, and ritual behaviors, as well as support for children in their transition from the preschool classroom, and support from family members, including professionals involved in the treatments. So here what are we saying? We are saying is that not only do we need an autism specific curriculum, we also need a structured classroom. We need teachers and parents who are supportive and who will provide supportive classrooms and home environments, as well as family members, the parents, the siblings, the grandparents, all need support. So professionals need to provide that also.
That means in early intervention, it's important that not just the classroom teaching is providing the child, but as well as the parents, the family. The child has to have a very holistic environment along with the teachers at the professional level and the parents at the family level, both providing the child with very high level of support.
Okay, let's go on to attending skills, curriculum content. First, how do we build? We want our children have difficulty with eye contact. So how do we build eye contact? If I'm standing on top of the child and above the child, it's highly unlikely the child will look at me. I want to go down to the level of the child. And I do not force eye contact. Now if you're not looking at me and I say, मेरी ओर देखो, आपको कैसा लगा?
I won't like it.
आपको अच्छा नहीं लगा? So like that, we don't want to force eye contact. But if I put myself in your vision and I say line of vision, I say, hi Verena, hi.
So you try to gain
So
attention.
I will make faces. I'll try and gain your attention in some way, or maybe if I know you like a car, I will put that in your line of vision. You look at me. So one other thing is that parents and teachers tend to keep testing eye contact. They keep on saying, if I keep telling you Prerna, and I say Prerna, and you look at me, and I say Prerna, you look at me, how many times do you look at me? Nothing happens.
Yeah.
So whenever we call the child, something must happen. It's not that we are always calling the child and nothing happens. Joining the child and going with interest. We talked about that before. हमने पहले भी बात की थी कि जो बच्चे को पसंद है, we will take that. And now supposing the child, can we do a demo? Suppose the child is doing this. I will go in front of her and I will do the same thing. And maybe she'll look at me. Hi, oh, good looking. So I'm giving her a praise, and maybe I'm giving her something she likes at that point of time.
Okay.
So if it's a kurkure, or if it's a taga, or if it's a car, I'll give her that.
So you're supposed to give the child what the child likes.
Yes.
Okay. Only then will the child be responding to what
Yeah.
you're doing.
Building joint attention. Now what do? Is that very often we kind of tell the child, Acha, supposing I want that, will you give me that ball? Suppose there's a ball up there, and will you give me that ball? Now instead of doing that, if I say, okay, can you give me the doll? So I touch the object instead of pointing at it. When I'm looking at a picture book, if I'm looking at a picture book, I will point and name the pictures while looking between the book and the child. I look at the book, I look at the child, and then I look at the book again. Creating surprises. I'll put something in a bottle. and I'll shake it and I'll say, okay, now let's see what is in this bottle. And we open it, and there's something there that the child likes. Suppose the child likes a chocolate, and there's the chocolate there. So we are creating joint, we are looking at an object together. That is joint attention. Communication skills. Our children have difficulty with cause and effect. What is cause and effect? Cause and effect is when I do something, I put on a switch, something comes on, a light comes on or a fan comes on. Our children have difficulty with understanding this. They find it, that is one of the main reasons, they find it difficult to understand the why of communication.
The reasons, that means, are not understood by the child. Doing something.
Why should I communicate? Why should I look at my mother and ask her for things? Very often children have been found pointing to things in empty rooms without anyone there, because they do not realize that there needs to be someone there so that they can give you that thing. So we need to develop cause and effect reasoning. How do we develop cause and effect reasoning? We take simple toys like anything which you get these pianos where you press a button and a noise comes. You get these toys where you put on something and some lights come. You shake it and there's a noise. Just now you were trying this, it goes off.
Yeah.
So this is something where so that is how we develop cause and effect. We play a lot with the child with these toys.
So that means in cause and effect relationship, it's very important to make the child understand that whenever he's doing something, there is a reason for it, and there is going to be an effect when he'll do something.
There is always a response when he does something. Make routines and then break them. So we do things like this with the child. We play things. We play games like you play tickle games. Tickle bug is coming, and then you tickle. Okay. You do this several times. Then you say the tickle bug is coming, 1, 2, coming, 2, and then you stop. Then wait for the child to look at you.
Why don't you complete the whole process?
Yeah. Then once the child looks at you, then you say tickle and you give the tickle.
Okay.
You can do this with many things. You can do this with a chunni. You can do these peekaboo games. Things like this. Where's Viveka? Where's Viveka? Yes, Viveka. Where's Prerna? Where's Prerna? Where's Prerna? And you do this several times, and then I will stop.
Okay.
I said, where's? And you may look at me or may pull my hand.
Okay.
And then I'll put
So that means you're gaining the child's attention.
No, I'm making a routine. I am making things predictable for the child.
Okay.
I'm doing this many times. The child knows what's going to happen.
I think it's also a lot of social cause and effect.
Yeah.
Okay.
Because they might pick up the cause and effect with toys. You press a button and it will spring. You push the switch and the fan will get on. But here is the cause and effect with people, which is an issue with them,
Okay.
which they find difficult.
Okay. One more thing is we delay. What happens is that especially with children with autism, the parents tend to give them whatever they want before they've asked for it. What happens is, supposing I'm thirsty and I want water, and the water is there in front of me. Water is given to me as soon as even before I want it. Why should I need to ask for water? So we need to delay responses to anticipated needs and wants. I remember there was one child, there's a story about this child, where the child was asking for things in school, पर घर पे मम्मी बोलती थी कुछ नहीं पूछता है. तो टीचर गई घर पे और थोड़ी देर बच्चे के आने के पहले गई और उसने देखा कि मम्मी ने सब कुछ तैयार रखा था. वो उसके उसका दूध तैयार रखा था, उसे टीवी अच्छा लगता था, तो उसके फेवरेट कार्टून
पहले से
लगा के रख दिया था. She had his milk and biscuits ready, and as soon as the child came up, he didn't even have to knock.
Okay.
उसने दरवाजा खोला, वो बच्चा आके दूध पीकर बिस्किट लेकर उसका टीवी ऑन था, वो बैठ कर देख लिया टीवी. Now, where is the opportunity
For the child to demand
ask for
something.
anything? We need to delay responses to anticipated needs and wants.
So that means the parents should wait for the child to say something, to ask for something, and
Yeah.
then should they provide the
Yeah.
child with what the child wants.
Now, suppose the child likes kurkure. You put the kurkure in a bottle which is difficult to open for the child. So, what will the child do? The child will try and open, and then you say, okay, come to me, let me help you.
Okay.
So, you set up obstacles. Don't give the child everything easily. Put it in things that the child can't open. Hide it somewhere where the child can't reach. The child has to come. If he wants that, he will come and ask you for it. Be observant for situations that the child likes and dislikes. Now, if you know that the child likes something or he doesn't like something, supposing he's scared of this doll. Some children are very scared of stuffed toys. So, supposing I putting this near Indu and she's scared of it and and so I very exaggeratedly I said no, and I put it away so that she knows that there is a acceptable way of saying no. Supposing Indu has a habit of either pushing people away, or she has a habit of screaming when something she doesn't like comes next to her. Supposing I teach her that, look, yes, this is nice, and she screams, and I say no, and I'm teaching her the appropriate way of saying no.
Okay. So that means it's very important to understand what the child likes, what he dislikes, and accordingly then react to what he's doing and teach him.
And teach him the appropriate way to say yes and no.
Okay.
Offer choices. We need very often our children's lives are controlled for them. Supposing today, Prerna, your mother set out everything for you to wear, and every day she picked out your clothes. Would you like it?
No.
Why?
Because I would like to do it on my own.
Our children, and what about food? Supposing she put food on your plate every day. Would you like it?
No, because I like to take it my way.
Okay. Now, in our children's lives, their clothes are picked out for them, their food is put on their table for them. They are not allowed to have any choices. In things which don't matter, it really doesn't make a difference. We can, if they wear this blue shirt or the red shirt, let them pick out, give them a choice of 3 shirts which they can pick out.
Okay.
Give them a choice of food which they want, so that, and let those choices be visual. You can visual mean the real object, or you can have pictures of the object. So let them pick out things they want, because that, if they feel they have some control over their lives, it makes life easier for you and them.
So that means you should give a child options, more alternatives,
Yes.
so the child can choose what he wants himself.
Yes. Also, as far as leisure activities are concerned, if you give the child a choice between reading a magazine or watching TV or playing with the car, let him have his choice.
Let him do what he wants to do himself.
Especially during his leisure time.
It will also lead to a lot of independence
Yes.
later.
Okay.
Let the child feel his utterance of social consequences. Now, suppose a child is saying something which you don't understand, but you can bend down and you can give a meaning to it.
Okay.
Supposing the child wants water, and the child said wah wah. She said water.
Okay.
So the child may not mean but water, but he has a certain word for water which you're shaping and you're making it into the appropriate word. Increase the understanding. Our children have difficulty in understanding the process of communication. What is the process of communication? Process of communication is that this is a very unusual situation where I'm talking a lot and other people are listening. Usually it's a two-way process. So I will talk and you will listen, and when you talk, I will listen. Our children have difficulties in this waiting, in turn taking, in waiting. So we need to play turn taking games with them. We need to play games like any game which we start, we can play, even if we are doing the tickle game. He can take a turn, I can take a turn. he can take a turn, I can take a turn. Or if you're swinging, if the child likes swinging, he can swing, wait. Then you can tell the child, okay, now I will sit on, now it's my turn, and you push me.
Okay.
So we need to teach the child that there is a certain amount of time that he has to wait. Encourage initiation. Start with something the child likes. Now supposing we know the child likes swing, and you don't put him on the swing immediately as soon as he sees the swing. Wait. Let him make some sign, give you some indication. Once he looks, even if he looks at you, you can say swing and give him the sign to swing and put him on the swing.
So that means we have to wait for the child to give you indications and signs as to what he wants to do.
Not even signs, even if he looks at you, that's enough.
Okay.
Indu had talked about alternative communication. AAC not only replaces but supplements and facilitates verbalization in an effective and consistent manner. AAC strategies are planned keeping the individual needs in mind. Very often पेरेंट्स और टीचर्स सोचते हैं कि हाँ हम कुछ और सिस्टम दे दें, हम साइंस दे दें या पिक्चर्स दे दें तो बच्चा बिल्कुल बोलेगा नहीं. It is not true. Just pretend, supposing you've gone to a country where you don't know the language and you want water. Will you wait till you learn the language before you ask for water? No, you will make the universal sign for water, which is this. So supposing someone says you're in Tamil Nadu and someone says Tanni, and you're listening to that sound Tanni and you are making the sign. Then next time you make the sign, you say Tani because it's very close to Pani.
Yeah.
And someone will correct you and say no, Tanni. So what is happening here? You are making the sign and you're hearing the word. Our children also learn the same way. If they see a picture or they make the sign as well as they see the sign as well as hear the word, they probably learn language faster and they speak faster. It has been seen and a lot of research has been done where children who have used some form of AAC have developed speech faster.
So that means it's very important to discover and analyze and observe how the child is behaving. Now we're discussing about the early intervention of detecting autism in a child and determining it as early as it's possible, the importance of this early intervention, and we'll carry on with the discussion, but now it's time for a short break, so see you after the break.
This is Aparna. She loves chess and Shah Rukh Khan. Her best friend is Swati. She also has visual impairment. This is Neeraj. He plays many instruments. He loves Mohammad Rafi and cricket. He also uses crutches for mobility.
चंदा है तू मेरा सूरज है तू
This is Raj Bala.
मेरी आँखों का तारा है तू जीती हूँ मैं बस तुझे देख कर
With her husband and daughter. She loves cooking and watching TV.
सूरज है तू आ मेरी आँखों का तारा है तू.
She also has cerebral palsy. Look beyond the disability. Look at the person.
Welcome back after the break. We were discussing today's topic, that is importance of early intervention in autistic spectrum disorder. Until now we've discussed the importance of early intervention, what exactly it means, what is the need for the early intervention, and now we'll be continuing with ma'am, what exactly is imitation?
Imitation is नकल करना.
Okay.
हम सब कुछ we learn everything through imitation. If I am teaching you to knit and I tell you that now you take the tape, I can't even do it without showing you. If I tell you now you put the needle at the back of the stitch and you put the thread over it and you take it out, will you be able to understand?
No.
If I show you,
Yeah.
will you be able to understand? Imitation is a critical skill for all children, and especially it's for children with the autism spectrum disorder, because it is a foundation of learning. Basically,
Okay.
of foundation of learning is based on the ability to imitate.
So that means to be able to copy someone
Yeah.
is basically
Imitation.
imitation. Whatever she does, I do the same.
yeah.
Whatever I do, she does the same.
So,
Okay.
the ability to imitate impacts learning in all areas, including social skills and communication. क्योंकि हम सब कुछ नकल करने से सीखते हैं. How do children learn? Regular children learn how to behave. I mean, for instance, in India, we all do namaste. Abroad, in the Western countries, they shake hands. Children learn by observing their parents. So if their parents do namaste, they will do namaste. If their parents shake hands, they will shake hands. So all these things are learned through imitation. How do we teach imitation? We will start teaching imitation with objects. That's a little, the order's gone a little awry there. First, we start teaching imitation with objects. So if I have a toy, we'll do it with this, and I say, do this, and she's not doing it, and I prompt her, do this, and I give her reinforcer.
Okay.
Okay, so the instruction is do this. It is not कंघी करो. क्योंकि जब हम देख रहे हैं, if I say कंघी करो and I'm doing this, I'm not sure whether the child is listening to me and doing it, or the child is looking and doing it. Imitation is when you look and you do the action. So we first start with imitation with objects. We can start if we have objects also, we can do something like that. The objects must be exactly the same. So yeah, objects must be exactly the same. So if I do, okay Indu, do this, and you can do anything with objects. Whatever objects you have, you can use.
So that means the child will look at you and do whatever you are doing.
Yes. So after it is easier to start with objects, because when I am doing an imitation, if I say do this, that is more difficult because the child has to look at me. He has to motor plan his movements. He has to know that he has to do this, and then he will do it. So with an object, it's far easier. Sometimes our children have difficulty when I'm saying do this. They find it difficult. So if I put an object in their hands and I say do this, and she does that, it's easier because she's seeing the object go up.
So that means rather than saying that for example, rather than saying comb your hair, you have to just pick up the comb and just comb your hair, and the child will follow what you do.
You have to give the instruction, do this.
Okay.
Yes,
Do this. All right.
If we are working on imitation, the instruction has to be do this.
Okay.
If you are saying comb your hair, then it's just a command.
Yeah.
Okay.
Two different aspects.
So that means when you're telling the child to imitate you, do whatever action, but then just say do this, that's all. The two words do this will tell the child that you have to imitate what you are doing.
Okay. Now we come to following receptive instructions. This is different. They are in autism, our children have the difficulty in understanding the meaning of language. So what happens is that very often, what do? We're telling the child to sit, and the child is not sitting, and we are letting him wander around, and it's okay, but it's not, because if the child is not learning that actually sitting means sitting like this. So if I tell the child to sit, I have to follow through and make the child sit. We generally start with simple instructions like put in, pull, give, because put in is very simple instruction which is very visual. So you can show the child to put in, you can prompt the child to put in.
So that means we start with very basic instructions,
yes,
which the child can very easily understand rather than the complex ones later.
Yeah. When we are giving a receptive instruction, and supposing I am saying comb hair, I will not comb my hair. I will just put the comb in front of the child and I will say comb hair. If the child is not doing it, I will prompt the child to do it. I will not comb my hair, because that is imitation.
Right.
There is a difference. There is a difference between following a receptive instruction and in doing imitation.
So that means imitation means when you're showing the child what to do and say do this, the child will imitate what you're doing. But in receptive instructions, what you do is you tell the child that comb your hair, for example, the child will pick up the comb and comb his hair, or you to prompt the child to do the same. So it's like that. You to command the child to do something, then that's receptive instruction. If you're showing the child what to do and saying do this, then that is called imitation.
Okay, we come to matching now. Matching is also a very important part of our lives. I would not wear, maybe I'd wear this, but I would not wear this color with what I'm wearing, a green chunni with what I'm wearing, a bluish green chunni with what I'm wearing. Matching is something we do throughout our lives. How do we start with matching? We'll do an object to object matching. First, maybe we will just do one object. So I will tell Indu match and she will put it down. Matching is when you put two objects side by side. Sometimes maybe if the child is finding it difficult, I will have a paper and I will say match and the Indu will put it on the. So I am giving a structure to the matching so that the child knows that she has to match within the paper. Otherwise, matching can be done. Supposing I tell the child match and the child puts the object here. It's not wrong.
So within the basic framework, the child has to match the objects.
So once the child has understood the instruction match, then we will do with two objects. So I'll start with an object she already knows and I say match and she does that. And I say great matching and I give her a reinforcer.
Okay.
Alright. And then we go on to 3, 4 objects. We first start with objects, then we go on to pictures and object to pictures and matching colors and shapes. Language skills. Whenever we talk to a child, we speak from the child's perspective. Our children have a difficulty with I and with pronouns. Me, you are difficult for him. So supposing if I say तुम्हें दूध चाहिए and child will echo तुम्हें दूध चाहिए. So if I say मीता को दूध चाहिए, so the child will say मीता को दूध चाहिए. So that is an appropriate way.
Okay.
So I am speaking from the child's perspective. Label the environment, whatever the child is doing. If the child is combing his hair, say okay, Meeta is combing. If the child is playing with the car, say okay, Meeta is playing with her car. Or the child is playing with, so the child is just playing with this. Oh, Meeta is playing with Noddy's cap.
So that means instead of using pronouns, we should rather use nouns.
Nouns and use the child's name and also label what the child is doing.
Okay.
So if the child is ringing, she's ringing Noddy's bell.
Okay.
So here we are just labeling. Accompany comments or requests with gestures or props. If I want something, I will make a very exaggerated gestures. If I say okay, इंदु को डॉली चाहिए, ले लो डॉली, गुड जॉब इंदु, ले लो. So I'm doing a lot of अच्छी लगी डॉली, look good डॉली, nice डॉली, and I'm giving a lot of emphasis, a lot of exaggeration. Teach names of common things, spoon, glass, spoon, etc.
So, for example, we tell him that this is a doll, this is a car, this is a comb.
And we start with objects and then go on to pictures. Okay, now, where we also have to teach activities of daily living. These are very important activities like toileting, eating, and dressing. They're very important as they increase independence and facilitate social integration.
Okay. So that means we were just now discussing about the various ways like imitation, receptive instructions, and then she just told us that imitation means that when you do something, you tell the child do this. Receptive instructions means when you tell the child to command something, you command the child that you're supposed to comb, the child will comb then. But there is this difference that is there between the two. And now we've discussed about the importance of early intervention, the need for early intervention, how it really goes about it, the processes of early intervention, and the various ways we go about it. And now we'll continue with the discussions after we followed up with the various skills also involved with an autistic child. We go ahead with the visual supports now.
Yeah. We said that in the very beginning, autism is a condition in which there is an impairment in language and in communication. तो क्या होता है कि जिन लोगों को autism होता है, they have a difficulty which is known as slow processing of language. And just to give an example, like Viveka, don't follow what I'm saying. So suppose I tell Viveka कि Viveka comb दे दो. Now she's not giving the comb, and generally this happens a lot, in classrooms, at homes. Like I've said, comb दे दो. Now विवेका के brain को ये जो auditory input गया है comb दे दो, इसको process करके इसका meaning समझ के एक response देना, that is picking up the comb and giving me, probably कभी कभी क्या होता है या अक्सर slow रहता है as compared to any other person. But what happens is I say विवेका comb दे दो, मैंने क्या बोला है, now I start saying मैंने क्या बोला है, comb दे दो, तो again there is a cut off and her brain goes into मैंने. तो maybe जब first time I said कि विवेका comb दे दो, तो उसने विवेका comb सुना और then the next she heard was मैंने. तो she's not able to make sense of the thing because I'm saying so many different things, I'm verbally overloading her. It's seen that children with autism, they are very good visual learners. सुन के सीखना, we are all good auditory learners, but we also learn better अगर auditory के साथ हमारे पास कुछ visuals भी हो, हम better सीखते हैं. But for children with autism, their strength is visual learning. अगर उनकी learning में हम कुछ उनको pictures, objects, visual supports दे सकते हैं, they can understand better what we are trying to say and what is important at that situation. So let's see how it's done. Just very simple examples, like ये सारे हम visual cues बना सकते हैं. Visual cues actually can be pictures, they can be small objects. For example, the first one on the top, these are just colors. So if we have a picture card of crayons and we show it to the child and we say now हम लोग coloring करेंगे, तो जो लैंग्वेज हम बोल रहे हैं कलरिंग करेंगे के साथ एक विजुअल है, द चाइल्ड अंडरस्टैंड्स बेटर कि इट्स टाइम फॉर मी टू डू अ कलरिंग एक्टिविटी, एंड देन लैंग्वेज दैट आई एम सेइंग हैज मोर मीनिंग बिकॉज इट इज सपोर्टेड बाय अ विजुअल. सिमिलरली अगर खेलने का टाइम है तो एक बॉल का पिक्चर दिखाया है, द नेक्स्ट पिक्चर इज नॉट वेरी क्लियर, इट्स अ CD. I show the CD to the child, music time, and the child sees the CD and knows that it's time for the music. A remote again can be it can be a symbol for TV time, keys for a scooter ride or a car ride. और अगर हम soap का रैपर एक हमारे पास हो, और ये चीज़ें हम अगर इकट्ठी कर ले बच्चे के लिए, that these are the visuals we are going to show to the child for communication, it becomes very effective. The whole process is a very detailed one. As the child grows up, हम इनको line up करते हैं to make visual timetables for the child, but at an early intervention level, if we use objects as symbols of activities, if we use pictures as symbols of activities, हमारा communication उनके साथ बहुत clear हो जाता है.
So that means along with the auditory things, we have to have visuals also, which will enable the child to understand much better. For example, if you have to say comb your hair, we can just show the child the comb and the child will understand that you have to comb the hair.
Absolutely.
So it means to show objects with the help of objects and visual clippings. It's very important the child will enhance his learning process.
And he'll understand the communication, the language better. So why do we use such symbols or visual cues? Because they are very concrete, they are predictable, they stay in front of the child and they make communication easier to understand. तो ये concrete है, इसमें कुछ इमेजिनेशन नहीं करना है बच्चे को, बिकॉज अदरवाइज अगर हम वो कुछ, कई बार हम लोग बहुत इमेजिनेटिव बातें करते हैं. फॉर एग्जाम्पल लाइक सपोज आई कैन हैव अ कोम and I can have keys which I don't have, let's assume that these are the keys. So I say comb your hair and we'll go out. Comb your hair, फिर हम बाहर जाएंगे. टॉय कार्ड भी दिखा सकते हैं बाहर जाने के लिए. Now it's concrete. अगर मैं बोलती हूँ पहले कोम कर लो फिर बाहर जाएंगे, उसमें बच्चे को एक वर्ड सुने हैं लेकिन उसको इमेजिन करना है कि व्हाट डज दिस मीन. ही हैज टू ट्रांसलेट देम इनटू व्हाट दे मीन एंड यू नीड सर्टेन अमाउंट ऑफ इमेजिनेशन फॉर दैट. सो वी आर मेकिंग ऑल दीज थिंग्स वेरी कॉन्क्रीट फॉर द चाइल्ड, वेरी प्रिडिक्टेबल फॉर द चाइल्ड, एंड ऑल्सो द कम्युनिकेशन एंड द लैंग्वेज ईजियर फॉर हिम. This is a sample, and you know, we're talking about early intervention and up to 6 years. These are the kind of visual schedules or the visual timetables. We have actually seen that even very small children as young as 4 years are able to make sense of them. So they know that in the morning the teacher does a calendar time, then you sit and work with the teacher, then you play with the sand, then I'll have to write something, then I'll jump on my trampoline, then I can play on the computer, then I have some textured balls, it's a sensory thing, and then there's tiffin time. So इस तरह के जो visual schedules होते हैं, they really help the children. They tell them that what is going to happen in what sequence. And very often when these little kids go to school, ये बहुत anxiety रहती है, tiffin, they want the tiffin. But ऐसा visual schedule होने से बच्चे को मालूम होगा कि मेरे को टिफिन कब मिलेगा, कितनी एक्टिविटीज़ के बाद में मिलेगा, और it's predictable, it stays in front of the child, वो बोर्ड पे लगाया जाता है. और जो शेड्यूल बनाते हैं बच्चे का, कोशिश की जाती है कि उसमें जो हम विजुअल्स डाल रहे हैं उसमें कुछ एक्टिविटीज़ उसके इंटरेस्ट की भी होती है, एंड इज़ वेरी मोटिवेटेड टू लुक एट हिज स्केड्यूल, एंड इट गिव्स हिम अ लॉट ऑफ कंट्रोल ओवर हिज ओन सेल्फ, ओवर व्हाट्स हैपनिंग विद हिम. मेरे से क्या एक्सपेक्ट किया जा रहा है, मैं क्या एक्सपेक्ट कर सकता हूँ अपनी टीचर से, कि अच्छा वो मुझे टेक्सचर्ड बॉल्स देंगे खेलने के लिए, अच्छा अब मैं टिफ़िन एक्सपेक्ट कर सकता हूँ. सो lot of behaviors, difficult behaviors of children, they are also controlled through such visual timetables. But at a very early intervention level, first we have to just teach them like this, कि like I said, कि we show them a comb and say comb करेंगे, फिर कार में जाएंगे, और पहले हम उनको इन cues के साथ familiar करते हैं. एक स्पून दिखा के या एक टेबल का, डाइनिंग टेबल के ऊपर कोई मैट होता है वो दिखा के, खाने का टाइम. First the child gets familiar with what these cues means, and then we line them up into schedules, and these really help the children. और हम लोग जैसे बहुत बार ये सोचते हैं कि ये सब इतनी मेहनत की चीज़ें क्यों करेंगे बच्चे के साथ, अब इसकी पिक्चर्स बनाएं. तो एक बात हमें याद रखनी है कि यदि कोई बच्चा है जिसको कोई और प्रकार की डिसेबिलिटी है, लाइक विजुअल इम्पेयरमेंट है, उसके लिए ब्रेल है, उसके लिए केन होती है, वो चलने के लिए उसको ज़रूरत होती है. और अगर कोई बच्चे को हियरिंग इम्पेयरमेंट है, उसके लिए हियरिंग एड्स हैं. तो ये, और सीपी है, लोकोमोटर डिफ़िकल्टी है, व्हील चेयर्स होती है, ये हमारे बच्चों की व्हील चेयर्स हैं, ये हमारे बच्चों के ब्रेल सिस्टम्स हैं और हियरिंग एड्स हैं. यही वो सपोर्ट सिस्टम्स हैं जो एक ऑटिस्टिक बच्चे को हेल्प कर सकते हैं. एंड वेरी ऑफन यू हैव टू रियली बैटल विद स्कूल टीचर्स व्हेन दे से व्हाई विजुअल schedules, व्हाई विजुअल cues. and then you have to explain that it is a disorder in which visual supports are needed, and those are the kind of supports which will help a child towards independence. तो शुरू से ही अर्ली इंटरवेंशन में हम एक्चुअली पिक्चर्स और ऑब्जेक्ट्स के साथ उनको कनेक्शन और एसोसिएशन देना स्टार्ट कर सकते हैं, ताकि आगे जाके हम उनके विजुअल टाइम टेबल्स में वही क्यूज डाल सके.
So that means if a child is having a schedule, a timetable with visuals in it, it's very easy for the child to enhance his understandability, his basic nature of understanding things as to how and when the things are going to happen. For example, as ma'am told us that if we show a child the comb, we'll say comb your hair and then maybe we'll go out for a drive. So the child will understand that first he has to comb his hair and then he'll be taken out for a drive.
Absolutely.
So similarly, when these objects, when we'll show the child objects, he'll understand, and when he'll basically grow up with the experience, then we can have cues and visuals and clippings and drawings in the schedules and timetables, so that the child can understand, okay, first he's going to have one activity, then another, and then another. So he'll understand the procedure as to when what is going to happen. So this is increasing the child's concepts and understandings.
And we all need it actually.
Yeah.
But we are able to do all that organization in our mind, and we are able to ask a lot of meaningful questions कि फिर क्या होगा, उसके बाद क्या करेंगे. But they are not able to ask, and they need predictability. You just imagine your own self. If you didn't know what's going to happen next, what would happen? So this is...
so that means this increases predictability also. So that means in today's topic of discussion that we had was importance of early intervention of autism spectrum disorder. We discussed a lot of things like autism, what it means, what is early intervention, what is the need of early intervention, what is its importance, at what stages the child can have an early intervention. For example, as they told us that we can have the child can understand the basic signs can be first indicated at the age of 18 months, that is 1.5 years, and which can be confirmed only at the age of 30 months. Before that, they can just say there's a risk of it happening or not happening, which is confirmed at the age of 30 months. So that is what is early intervention. And then we discuss the various activities that are involved with an autistic child, the various skills that can be involved, the various other procedures that we can go through for the understanding of an autistic child. So we had a lot of discussion. I hope all our information was useful to our viewers. For any kinds of suggestion and feedback, please get back to us on our numbers or our email address. So that's all for today. Thank you so much for joining us. We'll see you on the next show at the next time.